Hello everyone, I'm Dr. Farhan Tahir, rheumatologist at the Cancer Treatment Centers of America in Philadelphia. Today I'm going to discuss with you about a recent study that I came across that was looking at risk of cancer in patients who have been treated with biologic therapies for rheumatoid arthritis treatment. Rheumatoid arthritis treatment has been revolutionized in the last 15 years. We have many biologic therapy, including anti-tumor necrosis factor, abatacept, tocilizumab, rituximab, and the list continues to grow. We have been asked this question many times from our colleagues and from our patients whether these newer agents change our immune system and whether there is any connection between development of cancer with these drugs. Although whenever we are starting these medicines, we are giving patients warning that there might be a slight increased risk of malignancies or they cannot be used in patients who have concurrent active malignancy, we always worry about whether there is any association. A recent study in Sweden looked at a population cohort of rheumatoid arthritis patients and compared them with general population. The good news is this study did not find a correlation between use of biologic therapies and higher incidence of cancer. There were about 100,000 adult normal population that was compared with about 45,000 patients who were treated with traditional DMARDs such as methotrexate, plaquenil, sulfasalazine, leflunomide, and there were about significant number of patients who were on biologic therapies. About 10,000 patients were on anti-TNF factor medicines for the first time. There were about 4,500 patients who were on second time on anti-TNF therapy. There were about 2,000 patients who were on tocilizumab and abatacept, and about 3,500 patients who were on rituximab. They followed these patients, and the incidence of cancer was monitored for any malignancy that was related to or was thought to be related to after starting their new biologic therapies. They did not find a higher incidence of malignancies other than that abatacept, one of the biologic agents, had a higher risk of squamous cell cancer, and otherwise no significant risk was found. So if you have been diagnosed with rheumatoid arthritis and your doctors are talking to you about possibly starting biologic therapies, it would be easier for you to make that decision if you knew that there's been no clear link of cancer. Rather, inflammation, when it's under control, your risk of development of cancer is much lower. If you let your rheumatoid arthritis go uncontrolled, you have a higher risk of development of rheumatoid arthritis. So making sure that you are eating healthy, you're staying active, you are up to date on your vaccines, and you've been screened age appropriately for cancer, there's nothing else you need to worry about when you're starting these biologic therapies. I hope you will find this useful. Please subscribe to my channel and stay tuned. I wish you best of luck for your health and wellness.